Good morning and welcome to Flashpoint, the voice of national unity. I'm David Coty. We are here today at the Benson Hospital in the office, in fact, not her office, but one of the offices of the Benson Clinic, talking with the COO. We grabbed her downstairs, so we couldn't go back upstairs, so we're talking with her here. And we want to let you know that the Benson Hospital is alive again. And she's going to give you her own story as to what we mean. And so, welcome to Flashpoint once again.
Thank you, Mr. Coty, and thank you always for your persistence. I've always
Yeah, okay.
for knocking on my doors
Yeah.
to help me out. I
Yeah.
really appreciate it.
Right.
It is the first time I never ran behind anyone. The person just running behind.
Oh, yes, yes, yes.
So I'm blessed to have you
Yeah.
promote our business.
Thank you very much. Now, please tell us your full name and your position here.
My name is Sophie T. Power.
Okay.
I'm the CEO for Benson Hospital.
Okay.
And I established a research firm in 2019 as a result of my PhD work.
Okay.
Eventually, the research firm turned into other different things,
Okay.
and now we are into hospital management of WIC systems,
Okay.
revamping WIC systems, developing strategic papers or strategic documents for organizations or entities that want to revamp their systems.
Okay.
So I came here in March, on March 25th, 2025 this year. This hospital was about to close, and they also said to me to revamp it and rebrand it.
Okay.
Yeah, so that's, and here I am revamping and rebranding.
Okay. At what stage did you see the hospital when you first came in before you started the rebranding or the upgrading?
The hospital was just about to close. They were about to close their doors. Yes. Dr. Benson, who owns the hospital, had paid all the staff servants, meaning the place would close. It means that it was closing. And then when I was brought in, I said, no, don't close it. This place is strategically located.
Yeah.
Let's see what we can do. And so he agreed, and then we went into an agreement, and he also said to me for 5 years.
Okay.
Yeah.
Now, from what I see or what I have seen since I entered here, it doesn't look like something that was closing. So how did you manage it in a short period, 4 months? Did you say 4 years or 4 months?
4 months. Well, actually, from April 1 officially till now, I started. So it's about vision. It's about what you really want to do. Coming into Benson, I was actually working with the private health facilities, seeking access to finance for them. So from that experience, I actually jumped into Benson Hospital, honestly knowing the issues and knowing what to tackle first. In my previous job as chief of party for Kemolis International Private Health Projects, FHM, I knew exactly what the issues were. So when I came here, I started to tackle some of those issues. And so one of the issues was, cleanliness, cleaning, patients want a clean place.
Yeah.
They don't mind to pay any money if the place, the environment
It's conducive.
is friendly and favorable customer care.
Yeah.
The nurses, the healthcare workers talk to the patients, and then making sure we have medical equipment, we have drugs, we have good laboratory, and we have staff up to at least some standards. And since then, we met looking at our data. We came, I think by March.
Let me just throw in my next question so that you can, because you're coming to it. You signed an agreement for 5 years.
Yes.
What do you hope to achieve at the end of the day after 5 years? Because I'm sure there is a provision perhaps for renewing.
Yes,
Yeah.
if the Bensons are happy and they want to renew the contract, fine. But between now and the end of the 5 years, I want to make this place a real private hospital hall where patients can come and get good care, and to keep the name and legacy of Benson. It's a known hospital and it's popular, and people need to know.
Oh, go ahead. No, you can keep talking.
I hope it's not me. Sorry.
Yeah.
Let me shut down.
You can
Shut
keep
up.
talking so we don't have interrupting. You can keep talking while you can.
So I want this hospital to continue to serve the Liberian people in 5 years, because we are in a low income community,
Yeah.
and although people find themselves in low income community, what I want is when they come, they get standard, uh, proper care, and this service continue to operate even after the 5 years. So the vision is to revamp various areas. One, right now we do not have a pediatric ward.
Okay.
This is a 63-bed hospital, but we need a pediatric ward, children hospital,
Children hospital.
children ward.
Okay.
We need a proper maternity section.
Okay.
We also need an active emergency room, which we just, as you can see, this was the emergency room, this space right here,
Oh, okay.
right behind you. But in less than 4 months, we shifted to a new place, and I'll take you there for you to
Yes.
see.
Really see it.
And then the theater, the operating theater, I want to make this place a hub where surgeons from all over the world can come and bring their patients and do quality. So it's part of our plan to revamp the theater, to revamp the imaging section, the X-ray, and different types of imaging. But we've done the revamping of the laboratory, which I'll take you to.
Okay. Would your revamping or upgrading take into consideration having it as a referral hospital in the future?
Yes. Yes, we are to be a referral hospital, which we are in the region right now.
Yeah.
All these facilities around us are referring to us.
Oh, okay.
Yes. So to be a full-fledged referral hospital, we need other things like real up to standard ambulance. We need other cadre of specialties. Right now we have 2. We want to add 3, 4, 5 more. So, and then we medical equipment, and then revamping. I mean, painting, changing the entire structure. Yeah.
Okay. Let's talk about your staff a little bit.
Okay.
One of the major things in any hospital is to have staff that will not be in a lugubrious mode, a sad mood, and making patients feel bad, talking to them anyhow. Tell me about your staff. Do you have good customer service staff here?
Like I said, when I came to you, I said I inherited a team. I brought on board additional staff, but the team I met here are still here, and I'm working with them. So there are areas that we started to work with the staff on customer care, on waste management, you see around, on different skills. But customer care, yes. From the doctors straight down to the cleaners, we've been doing training with them. We've been doing on the spot mentoring and discussing with them, and also getting feedback from the patients. Did they talk to you properly? How was your care here? To give us feedback on how our customer care is. We are restructuring as well. Like now, we have a dedicated nurse, registered nurse, who is just assigned to the outpatients department. So she will coordinate, make sure the patients are treated on time, make sure the lab is, the results come down, make sure everything about the patients would be, tracked. We never had that type of structure before.
Okay.
We now have, like, the nursing directress, you meet her. Under her, we have a structure now. Each of the units have supervisors, and those people work under them. And Dr. Ilya is our medical director, so he coordinates all of the medical services.
You talk about a group under which you are operating. In other words, they are your supporting arm. Tell us about it.
So in the 2019, I established Center for Population and Reproductive Health. It actually came as a result of I'm a student. I started PhD, and my PhD is in social work research
Okay.
with emphasis on medical research and medical. So, and go looked at some recommendations to the board, to the government, and different. And now I'm managing Benson Hospital. So, Center for Population Health is the entity that I manage, I co-established with three other librarians, and we are here now at Benson Hospital.
What message do you have for others out there, especially in the diaspora, that are watching this program today? What do you want to say to them in terms of coming to your aid? Or let me not use the word coming to your aid, but collaborating with you
Yeah.
so that you can move forward and achieve your goal.
Good. So a lot of people like a group of medical team from the diaspora came here in March before I even came to Benson Hospital. They came here and brought technicians, biomedical technician, because we have one machine, anesthesia machine that was not working, and they came and fixed it. That particular group, I met with them and said it was the time I was negotiating with the Bensons, and I said, if I do get this contract, I would like to partner with you to help link Benson Hospital. Right now, we need beds, we
Okay.
need X-ray, we need ambulance. We need a lot of things to make this hospital operational. So Mr. Sako and I spoke, and unfortunately, when he was here, his sister passed. So I didn't push him further, but he's back in the U.S. And so they were talking. So these things that I need, what I could do for those of you in the diaspora, if you have medical equipment, mainly things that we need. Right now, I need beds. I need 63 beds. I need X-ray. I need so many different things. I'm willing to ship. I'm willing to clear.
Yeah.
Yeah. So for the people in the diaspora also, we have established a diaspora program. If you have your family member here in Liberia who is not well, we have a SendWave number that you can send their medical bills through. So we have had two of those cases.
Okay.
Yeah. So just send your patients to us.
Mm-hmm.
We treat and provide all the needed care just for not much money.
Okay.
Yeah.
Talking about not much money, are you affordable? From what I see here today, when you're passing by the hospital from the outside, it looks small inside, but I think it's a whole city I have seen here. Very big
Yeah.
place.
Yeah.
People get scared sometimes when they see the place improved. They think that you're so expensive. Are you very expensive or you are affordable?
We are affordable. I mean, imagine our consultation fee here is $1,000.
Oh,
1,000.
oh, okay.
And I mean, yes, we are in business. We want to do business, but at the same time, we need to look at the affordability of the people who come here,
Yeah, the environment, yes.
the environment. So it does not undercut the quality we provide.
Aha. I was
It does
just about to
not.
ask that.
So we are even getting support from others too, like the JMB Foundation.
Okay.
Called me on Friday
Oh,
and gave me a lot of medical supplies.
you mean the JMP Foundation?
JMB Foundation is not too far from us, right here.
You're talking about the President's Foundation, Joseph
Yes,
Boakai?
yes.
Oh.
President Bwaka's foundation. A lot of people have walked into like friends in the U.S. Madam Ide Gongo where came and donated a lot of things here.
Okay.
My in-law, Egna Wayne, she's in Minnesota. She came, brought her consignment, and said, gave me gloves, gave me everything, like some of these patient walker you see. And they are sending stuff just, to support me. one lady, when we took over in April, one lady just walked here and said, "Look, God is leading me to help you." I was not even here, but she talked to the cashier and said, "Look, this is my contribution." She gave $500. I still don't know. She said, "Please, I don't want my name to be." So a lot of Liberians are coming in to help. Most of the people here are indigent. When they
Yeah.
come, we still have to support them. But through, support from JNB Foundation, people like Edith Gonglo Way,
Did you make
and
a
all these
request or
other.
they just came on their own?
I went there.
Oh, okay.
I went to them. I told them, "Can you come and help me?" She said, "Look, take her to the warehouse, give her what she wants: drugs, medical supplies." She gave me, baby warmer. So people are coming in to help.
Okay.
Yeah.
Okay, we'll come back to you and end this interview with you. But please permit us to talk to one of your doctors.
Okay.
And then from there we can talk to the head of the nursing group. And
Okay.
we'd like to see your laboratory.
Thank you.
So let us talk to,
Thank you.
yes. We are moving towards the
Straight across.
straight across.
Their consultation one is Dr. Fokoli,
Okay. No problem, no problem. Yep. Okay. All right.
just right in
Yeah.
here.
Okay.
Yeah, here.
Oh, okay.
This is Dr. Kokoli.
Okay, Dr. Kokoli, how are you, sir?
Yeah.
How you doing?
Thank you.
How are you?
When you see the doctor's face, you feel well.
Yes. And Dr. Kokoli is one of the government of Liberia Ministry of Health
Oh,
is helping us, and they assigned him here,
oh, that sounds good.
and he's been
Please have a
very,
seat,
very
sir.
supportive. So,
Okay.
all right.
Okay.
You can talk to Dr.
Okay, Dr. Kokoli, thank you for the opportunity. We are just here to talk to the authorities of this entity. Uh-huh. All right. We contacted Mrs. Pound and we heard about her initiatives to revamp this place or to upgrade it. And so she agreed to my coming here, and we not coming here to first to come to the radio station, and we had some interview with her. And I told her I would like to come to the entity that you are revamping. You have come and we have listened to you, and so she agreed that we'll be here today. So we started the interview with her, and please introduce yourself. Can you come closer?
Uh, I'm Dr. Bona W. Kokoli.
Hmm.
I'm a general practitioner and I work with Ministry of Health.
Okay.
I'm assigned here at the Benson Hospital.
Okay. Well, we who are not medical doctors may not know what you mean by a general practitioner. What does that mean?
I just did medicine generally. I'm not specialized.
Oh,
So if you just do medicine and you are not specialized, then you are a general practitioner.
that means you can do anything when it comes to medicine?
Of course, yes.
Oh, okay. That sounds good. We have heard it many times but did not know what it really meant. So, what have you done so far since you came here to change the face of this place? We heard from the CEO that it was about to be closed, and she decided to take over, and she has a 5-year agreement. So, what have you done so far in your capacity as one of the doctors here to help change this place?
Well, I've done a lot
Okay.
because I got assigned here sometimes around November 6th of 2023. By November 6th this year, I will have spent 2 years here. But when I got in, the hospital was at the point of closure
Okay.
because the intake of the patients had reduced and they had some issues with managing the hospital.
Okay.
So as a result of that, the hospital was now up to date, and patients were backsliding. So because of that, the owner of the hospital, in person of Dr. Benson,
Okay.
decided to have this place closed because of the patient flow had reduced drastically. But then he outlined how he was going to do the closure. He said he was going to reduce it to OPD. Then from there, before finally he could come to the decision of permanent closure of the hospital. But as per your question, I have been making efforts since I came here. My contribution has been I've been committed to the process. I come to work every day according to my schedule. There was a point in time where we were only two doctors here. I was from last year, December, up to this year, July. We were only two doctors. So it's like we were working back to back.
Okay.
You come and work 24 hours, you go home, the next day your friend come, the following day you come. So we've been committed in the process because we never wanted the hospital to be closed down. Okay. So we did what we could do in our capacities as doctors. We do surgery, we see our patients, and we noticed also that the hospital is very vital to the community. Okay. This community is one of the poorest community in the city of Pinsville. Okay. So I deemed it necessary to make frantic efforts so that the hospital should not close down because there are a lot of cases, there are a lot of patients that can come here. And somewhere around here, besides the health center here, Duporo Health Center, and the James David, this is the only bigger hospital that is supplying this whole community with health issues.
Okay. Now, what are some cases that you handle here from time to time? And tell us about the surgery side. What are some cases you see frequently, or cases you have dealt with so far since you've been here as the most critical cases?
I have dealt with a lot of cases, medical conditions, including hypertension, severe cardiovascular accident, diabetes ketoacidosis.
In other words, you are a cardiologist.
No.
No. Okay.
Cardiologist is known for people who are specialized in that area, but I'm not a specialist doctor. Okay. I'm just
general. Okay.
Yes.
Okay.
I see all these general cases on the peripheral level.
Yeah.
But those who are specialized like cardiologists, they go depth.
Okay.
Yeah, but I do it superficially, but I have knowledge of all of them.
Okay.
But I'm not specialized in any area.
Okay.
So I've dealt with these conditions that I just mentioned about cardiovascular accident, hypertension, diabetes ketoacidosis, malaria, some of these chronic illnesses, HIV/AIDS, hepatitis B patients, even those OB cases.
Okay.
Yeah.
Do men come here sometimes for treating prostate cancer, prostate enlargement? That's one of the leading problems around the country now. We're asking these questions because there may be people now, there will be people watching this program around the world. We're on Facebook, and it's going to be placed on YouTube also. And maybe people who will be watching and listening, and they have prostate problem, whether it's the benign prostatic hyperplasia, which is the prostate enlargement, or the prostate cancer, and they want to come here. Do you accept them and do you treat them?
Since I came here, I had a colleague that was here, one Dr. Sarafin. I think he should be at EAWA. Here I did one prostatectomy before. That's the only case I know that we have done one case here. But besides that, yes, indeed, they do come here. We diagnose them. Okay. We put some of them on treatment, and we refer some of them to go see urologists.
Okay.
Just 2 weeks ago, I diagnosed one case, one
Yeah.
prostate case.
That's the most important to do, to diagnose it.
I did a diagnosis. I did a PSA test, and I explained to the patient, and I referred them to go see the urologist.
Okay.
But we see them most often.
Yeah.
Yeah.
Okay. Now, what would you like to say to us that we haven't asked you before we move to other departments? Maybe something we didn't talk about, what you want to tell us?
Yeah. It was so good that Mrs. Pound took over this facility, this hospital, because it was at the point of closure
Yeah.
when she came in. So it was, her taking over was very timely.
Okay.
Yeah. So it was a very good intervention that she took over at the point where by now we couldn't be talking about Benson Hospital if she had not come in, because the way the management of the hospital was going, yeah, patients were not coming.
Okay.
In fact,
And
the
what
owner
does
of
it?
the hospital has even downstairs some people.
Okay.
More than half of the workers
Okay.
were downstairs and they were paid off.
Yeah, she said
So
that.
we have like few other workers that we were here. So all of us that were here at the time, we were doing like 24 hours. This is back to back. But when she took over, she had a lot of improvement.
So what?
Some of the workforce.
Yeah.
To us.
What does the patient flow look like now?
Yeah, the patients are really
I mean, are they coming now?
coming in compared to
Okay.
March 25th, because she took over March 25th of this year.
Okay.
But currently we're having good inflow of patients. And it is because of that she's even able to pay the workers on the 28th or the 29th of each month.
Okay.
But before then, beyond March,
Things are difficult.
things were difficult.
And you are sent by the Ministry of.
Yes, I'm here assigned by the Ministry of Health.
Okay. That sounds good. Well, Doctor, it was good talking with you.
Oh, thank you.
And I hope you can watch the Facebook page later. I will show you I will give her the link and she will let you know.
Okay.
Also on YouTube. Thank you for accepting us in your office.
Thank you so kindly.
All right. Thank you, sir. Dr. Kokoli. From Lofa?
From Lofa.
Oh, good.
Loma.
Oh, I'm your brother.
Hatrap, Yela.
Oh, okay.
In the Sasa district.
Yeah, I'm from Zolowo, Sasa district. So we're brothers.
Okay. Yeah.
Thank you.
Okay. Thank you very much for coming.
Okay, so we're now going to another place. Perhaps okay. So Mrs. Palmer is going to tell us where we're going now.
So right now I'm going to the head nurse.
Yeah.
Nursing director.
Too close.
Let's go to the
Yeah.
nursing director.
Oh, okay.
Yeah, we're trying to restructure here. We'll do a lot of PT or different. Next time when you come here, you will see.
Yeah, a different. It looks good. It looks good. Don't get too close to my face. Oh.
So this is the nursing station.
Oh, good morning. Yeah, good morning. All right.
So let me take you to.
Yeah, please hold this. Yeah, whatever. Yeah, hold it.
Oh,
Yeah, just hold it. Yeah.
Yeah, the head nurse.
All right. We're going now to the head nurse, office of the head nurse.
Office.
Yeah.
Let me see. I hope she's here. Hi, Agna. Morning. I'm here with Mr. David Coffee.
Yeah.
He's here.
Okay, so good morning.
Good morning.
All right. 1 minute, please. Excuse me. Yeah. All right. Excuse me. Okay, we are now in the office of the head nurse, and she's going to introduce herself. Bring her chair. Sit this way to make it easy for her. No, I think you can come this way. Yeah. Okay. We are here now with the head nurse of the Benson Hospital. Please introduce yourself.
Okay, I am Mrs. Hekna K. Conti Dennis,
Okay.
the head nurse of Benson Hospital.
Okay. What is your term of reference? What are you supposed to be doing as a head nurse? To be blasting at the nurses?
Okay, my term of reference as a head nurse is to coordinate my nurses and is also to ensure quality care for our patients.
Are they up to date? Are your nurses up to date?
Yes, to that I can tell you yes, they are up to date because for the past month we have been having some training with them concerning how to talk to our patients, how to treat them well, and also when it comes to their duty as a nurse in the hospital. Yeah, we also train them to that. So I'm very sure and 100% convinced that they are all up to date.
Most people in Liberia complain about customer service when it comes to hospitals. Some nurses will be sitting, it starts from the receptionist. Sometimes she's sitting there, you are asking questions, they're playing with phones. Now, be frank and tell us what the customer service look like. Are your nurses people who don't pay much attention to the patients or what?
Okay, to that complaint for Benson Hospital, I'm 100% sure, like I said, because we have been having series of training with them. For the customer service, when a patient come, they already come with a problem. When I say problem, I'm talking about they are not okay when it comes to their health. So they are coming to seek even your counseling and your care from them. So our nurses, they are always on path. They talk to the patient very well. They even go beyond their expectation.
Okay.
When a patient come, the first thing with a smile, you welcome them and lead them to what they have come to do. Yes, so my nurses are doing well.
How are they recruited? Um, do you recruit them from places like TNIMA or how did they come here?
Yeah, for the recruitment, we put out for vacancy and they apply, and we observe them like for months plus before we can incorporate them. But most of our nurses here, they are from various schools. Some nurses, they graduated from Smart Institute, they graduated from Cottington University, they
Oh,
graduated from Mabel Macon, and even TNIMA. Yeah.
I see. Well, how many nurses do you have altogether here?
For our nurses, we have like 15 nurses.
15 nurses.
Yes.
You have a 24-hour service?
My nurses not ready.
No, I'm
Yeah.
asking whether you work here day and night.
Who are?
No, not you, the nurses. Do they work day, do they change shift?
Yeah.
Some work in the morning, some work in the night?
Yeah. The change shift. If you work today, another person will come and take over from you in the evening. That's how we do it.
Okay.
Because you have to be safe before you work. Yeah, before you can serve as well. Because if you like troubleshoot and think you'll be tired, sometimes your tiredness will even lead you to even say something to patient. Yeah. So we ensure that they have ample time to rest to come back. So the nurses, they can alternate. If you work in the day, another person come and free you in the evening.
Would you like to take us to one or two nurses that we can talk to? Before we do that, tell us what you want to say to us about nursing here that we haven't asked you.
Okay, thank you for nursing. Nursing, it is a unique field. It is a field where you play the role as a father or mother. Just how a father or mother, they don't have the distinction when it comes to their children. That's how you, the nurses, are. Because we'll have some patients, they will be very calm, they will be very moderate, and some patients too, they will come up with some anger and things. So you playing that role as a nurse, you should play that role as a mother and father to accept every patient like you see them. Yes. And per their status, per their religion, per every other place that they are from, you need to play that motherly role to them so they can feel at home. Because most of the patients, we are their last hope. If they come
I
and
like
we
that.
give them that careless care, or we talk to them that arrogant way, they feel very discouraged. It even intensify their illness.
Uh-huh.
So my message to all my nurses, we should always play that role as a mother and father to our patients, because
Okay.
they depend on us so much. Yes.
Okay. Well, thank you. I think you have made the last comments very, very good. It's in place. Yeah, so thank you. We want to, no, your name once again?
I am Mrs. Hector K. Dennis.
Okay, Mrs. Dennis. Thank you very much. May I have all right. Thank you very much. All right. She's the head nurse of the Benson Hospital. And where else you want us to go? Okay. Uh-huh. Yeah. Please be around so you can take us to the laboratory.
All right.
Okay. Yeah, okay. So which area is this?
This is the outpatient when it goes to the lab.
Yeah.
Sit.
Oh, okay.
Yeah.
All right.
Egna, I will pass this way. Pass a little bit back to the emergency.
Yeah, okay.
We'll also bring you here to the pharmacy. This is the new pharmacy.
People
We
to go
use
there.
this room for trauma and all these other rooms in case
Yeah.
we have an outbreak.
Yeah.
We have a room here. Like,
Oh,
since we'll be here, we have one case of empaths.
okay.
So we just put the person right in here until the government came to collect the patient.
Okay. I see.
This place was closed, right?
Our working nurses.
Oh, okay.
Yeah, she's the supervisor for the ER department.
The supervisor. Okay. Madam Supervisor, just 1 minute. I want to talk to you for a few minutes.
I'm Mother Kavi.
Mata Kavi.
Don't show our patient visit here.
Yeah, okay. Yeah. Mata Kavi. Now, what is your main reference, your term of reference? What do you do here?
I'm a registered nurse, BSc registered nurse.
Oh, BIC.
Yes.
So not just from the sidewalk.
No.
All right. So what do you rather do here? What's your job here?
My job here to take care of patient.
Okay. Start it again. The only question I could ask them was, what school are you people coming from? When they named the school, I said, well, I would not go to your school to report you, but you are wrong all over. So how do you do your blood pressure?
Miss the father son too. And you give me the another maybe how work to do too.
Thank you. What would you like to say to us finally before we leave you?
I want to say thank you for your concern.
Yeah.
At least you came to find.
Thank you.
Okay.
Your name once again?
Matter Coffee.
Okay, Madam Kavi, thank you.
You're welcome.
All right.
So
So,
we are going to the pharmacy.
yeah, oh, okay.
The new pharmacy we
All right. We're now walking towards it. From the pharmacy, we go to the lab. Oh,
Good morning.
good morning. Yeah, I came for some medication. I'm feeling feverish, feeling cool. So what can you do for me?
I just anything for you unless you pass your PA or doctor to prescribe for you before I give you medication. I can
You
just
passed my first test. You passed my test. 'Cause most people just walk to the hospital and diagnose their own cases. I got malaria. How do you know? No test. Thank you. Your name, please?
Dr. Bakulin.
Oh, Dr. Van. Oh,
Yeah.
too many young doctors here. Thank you.
Yeah.
Yeah.
Good morning, brother. How are you? Good morning. Yeah. Okay. What is the definition for pharmacist? What do you do here?
Okay, pharmacists are a group of people that make sure medication are safe and effective for patients.
Okay. Do you sell or give expired drugs here?
Oh no, that's not safe. So we don't do that here.
How do I know? Most of the time people want to get rid of their drugs even though they know it's expired, but they still want to get rid of it. Are you in that same practice?
No, I'm not in that same
Pardon?
practice because
Okay.
I'm a pharmacist and I took an oath to
Okay.
protect life, so I don't do that. So usually I track my medication expiration date. So once it's closer to time, like 2-3 days to expiration, I take care of the shelf.
Do you have enough drugs here for your patients, or you're like some of the hospitals we don't want to name now that when you go to, they give you paper and tell you a particular place to go to?
No, we have the basic medications here for patients, but there are some cases that are
I'm feeling chilly now. So why do you have it nice and cool like this? Is it good for the medicine?
yes, most medication should be stored in a cool, nice place.
All right. Let me just talk about one more thing, then I can leave you. Malaria and typhoid have the same symptoms. And people go to any pharmacy and just say, I got malaria. I need malaria medicine. And those pharmacists, some of them go to good schools, but they just give it because they need money. They need money. Instead of saying, where's the prescription from the doctor? Because it has to be, they got to diagnose your case first in order to know what to give you. What advice do you have for other pharmacists, other drugstores, people who just give medicine to people who just walk in? What advice you have for them? Are they killing the patients or are they helping them?
So usually the first person of contacting the community when somebody feels sick, usually are the pharmacists. But most times, like the drugstore, the pharmacists around don't have pharmacists on site. So usually, if the pharmacist is there, the pharmacist will talk to the patient, get to know their symptoms. Usually, we don't treat without diagnosis, but in a case where the patient is burning with fever and you talk to them, they list their symptoms, you can give something for the symptoms and advise the patient to go to the hospital and see a doctor.
Okay. Just one final question. OTC tablets or over-the-counter tablets are not very good. But are there any tablets that can be bought over the counter with a prescription?
Yes, there are
You
drugs.
pass my test. Don't even go too far. Thank you.
Yeah, Mr. Cody, another thing we've done, Dr. Bakula has been here
A month and a half.
And then she has transformed this pharmacy.
I can see it.
Like you see, everything is digitalized now.
You are preaching to the pastor. I can see it.
But what she has done since she's been here, she's been able to track expiries.
Okay.
So drugs that were expiring 6 months, she packed them, and we've done donations to JDJ and Hope for Women Hospital.
Okay.
So as JFK is giving us, as JM, which we think is the best thing, so that the drugs will
Well, you may get
expire.
short of drugs.
Yes, but if you have too much, but when we came the first time, we bought over $12,000 worth of goods from G2 Pharmacy. And those, at the time, we were not buying based on the data. We just bought, but now we have data to show which illness, medication. So our procurement now is based on the data we are getting from the outpatients and the inpatients. Some of the drugs we bought, we don't want them to spoil, but other hospitals need them.
They need them, yeah.
So that's how we did the donations.
Anything fun that you want to say to us before we leave? Just tell us what we didn't ask you that you want to talk about.
Yeah, now a lot of people know who pharmacists are, and I'm glad I got to talk to you people and highlight some of the things that pharmacists can do. Pharmacists are the middleman between the doctors and the patients. We advocate for the patients to make sure that everything goes right so that they can get well and go home.
Okay.
She's also helping us to look through the charts.
Okay.
I don't know the term. I don't know which.
Yeah, we assess prescriptions to make sure that the medications doctors are prescribing are safe for the patients and also are cost effective. Because there are some patients that financial strength vary. So even though a patient is sick, they need this medication, but even where the patient can't afford that medication, we can recommend to the doctor, okay, we change it, saying the patient can't afford that, so the patient can get well.
Change it to a cheaper one that will not work.
Cheaper option.
The cheaper option that will not work.
No, will work, yes.
But
equivalent to the, yes. And the patient can appear to a full and get well.
We have also had a case where sometimes some clinicians overprescribe. And she looks in the chart and says, no, this is just too much. You're not supposed to prescribe.
That is important.